The next class is the AT class by AD30. So aminoglycosides and tetracyclines, and they are gentamycin, neomycin, amikacin, tobramycin, streptomycin, and the side effects are these. So how the aminoglycoside work? They actually they work in three different parts. They inhibit the initiation complex formation. They misread the messenger RNA. Also, they inhibit the translocation. And how to resist this? We just alter these ribosomal protein structure or ribosome, and also we can use the transferase. We can modify the transferase enzyme, modify the bacteria transferase enzyme like acetylation, phosphorylation, or adenylation, etc. So what are the side effects? Side effects are pretty much interesting. So N for nephrotoxic, another N for neuromuscular blockade. So never in myasthenia gravis. Also O for ototoxic, so especially with the loop diuretics, which is also ototoxic, and it's a teratogenic, so never use in pregnancy. So where aminoglycosides are generally used? So clinical uses, it is not for anaerobes. So we use it for aerobes. So aerobes which are causing very severe gram-negative type of aerobes cause infection, severe gram-negative infection, invasive type, and we give neomycin prior to bowel surgery for bowel preparation. Also aminoglycoside synergistically work with beta lactam inhibitor, tazobactams, etc. So this is the general information regarding aminoglycoside. The next class is tetracycline, and these tetracyclines are tetracyclines, and tetracyclines are the doxycycline and the minocycline and the tigecycline. So how tetracycline work? Tetracycline actually they inhibit 30S ribosome, but how? They actually inhibit the attachment of amino acyl transfer RNA to inhibit the DNA, the protein synthesis. So how to resist tetracycline? Just make pumps which decrease the input and increase the output, increase the efflux of the enzyme, which are plasmid encoded pumps. So what are the side effects of this? Side effect is never use with antacid. Never use with antacid because it can antacids or milk of calcium. So because they decrease the absorption. So the side effects are they are contraindicated in pregnancy. Why? Because they can cause teeth discoloration in children. They can cause bone problems, inhibit the bone growth. They can cause photosensitivity and GIT distress. And next they have some clinical uses. We can use in patients with renal failure because the doxycycline especially the doxy is eliminated by the GIT, by the stool, fecal route, so we can use it for renal failure patient. They have doxy is also used for acne, topical use. They can also use, they have the limited CNS penetration, so that's why we can use it for general infections. Tetracyclines are important for Borrelia infection, also for Mycoplasma, Rickettsia, Chlamydia, and also for community acquired MRSA. So the tick-borne infection and atypical uh, pneumonia. And the Tigecycline is a pretty much broad spectrum. It's a broad spectrum. It can affect gram positive and gram negative, and it can cause gram positive, gram negative, and anaerobes also. So it's a broad spectrum antibiotic. It can cause its clinical use. We use it for deep tissue infection, and also we can use it for MRSA and vancomycin resistant enterococci. So now the general antibiotic for protein, and so here antibiotic is up to ant